Hello, good evening, everybody. I told you all to read the bones of the arm, and today we are going to discuss about the bones of the arm. There are just two bones which forms the arm, forearm. I'm sorry. The bones of the forearm are the medially is the ulna. This is ulna bone, and laterally is the radius bone. This is the radius bone. And there are certain structures which are marked and you're supposed to be knowing them. Here on the left hand side, it says the right radius and ulna in spination or the anterior view. On the left side, sorry, this is my right side. On my right side, there is right radius and the right ulna in pronation. See how it's turning around? It's in pronation and it's the anterior view. This is medially is the ulna which has been rotated and radius shift and the head of the radius has been made to come in the front. So in between there are structures which you have to know. First of all, I want you to know that this is number one. I'm sure you should know this, what this is. Number two, number three, if this is the radius bone, these are all the structures which are found on the radius. And number four, in between radius and ulna. Number five is here, see, on the ulna. Number six is also on ulna. 7 and 8, then 9 and 10. All right. Give a pause to the recording and write in the comments all these 10 structures that I've asked you to identify. It's very important. So many MCQs comes from the identification of these structures. Plus, the better you know the anatomy, the better you are with the surgery. So you have to know the anatomy inside out in order to operate on a patient, because so many structures can be present here. And the better you know the anatomy of both of these bones, the better it is for you to be a surgeon. Right, now I want you to identify with me. Number one, as you could see here, is the head of the radius bone. Number two is the neck of the radius bone. Number three is the radial tuberosity, right? Number four is the interosseous membrane, which is attaching or forming a joint between radius and ulna. It forms a, we'll discuss this. It forms a fibrous joint. Interosseous membrane forms the fibrous joint, and it's syndesmosis type of joint, which is formed in between radius and ulna. So this is number four. Number five is the styloid process of ulna, right? Styloid process of ulna. Number six is the ulnar tuberosity. This is ulna. This is ulnar tuberosity. Number seven is trochlear notch. This is the trochlear notch, right? 8 is the olecranon process. This is the olecranon process of ulna. 9 over here, this is radius bone, right? Remember, this is the dorsal tubercle of the radius, right? Dorsal tubercle of the radius. And number 10, the styloid process of the radius. See, I told you before, this is in pronation. That's why when you pronate, that makes radius come in front. Whereas in spination, both bones are lying side by side, as you could see. And if you remember, I told you, or you should know this now, radius and ulna are attached with this interosseous membrane, and they form this fibrous type of joint. And this interosseous membrane, it divides the forearm, as you could see here, into anterior and posterior muscular compartment. The one will be on the posterior view, will be the posterior compartment of the forearm, and this is the anterior compartment of the forearm. All the flexor muscles of the forearm will be here, attached here on the radius and ulna, and all the extensor muscles will be attached on the posterior side, on the posterior compartment of the radius and ulna. And what else I can tell you, that both radius and ulna have styloid processes. This is styloid process of ulna, whereas this is the styloid process of the radius. But most important, you have to learn. First, I want you to learn that there are many type of fractures that we'll discuss later with the bones of the hand, maybe, because most of the fractures which occur, they involve a patient falling on the outstretched hand, and that also involves the fracture of the styloid process of the radius as well. One of the most common fracture that occurs is the Colles fracture, and in that one, in that Colles fracture, it's very important. You have to know the clinical features of Colles fracture in order to attempt the MCQs which can be asked in Mrcs Part A. And in this one, patient falls on an outstretched hand, and it's a fracture of the dorsal or distal part of the radius. And it's the distal fragment of the radius which is forced proximally and dorsally, resulting in a dinner-fork type of deformity. So dorsally and proximally, dinner-fork type of deformity, that is the Colles fracture. So this is something very important you have to know. Both bones, radius and ulna, they are placed parallel to each other, as you could see in the interview in supination, whereas in pronation, moving of the forearm, radius comes in front. Right. What are the important fractures? Once Colles fracture we've discussed today, more I will tell you. But as I've told you, this interosseous membrane divides the forearm into anterior muscular compartment and posterior muscular compartment. Tomorrow we'll discuss the muscular attachments and which muscles performs which function in the forearm, and what are the nerves which are involved, or what are the nerves which are important in the arm and forearm, that we'll discuss. Right. With this, I'll end today's revision. See you with the next revision. Keep revising, keep studying. All the best.